All right. Well, welcome everybody to our Family Support Waiver listening session. We will be hosting a session today, and we will be hosting a session tomorrow as well. Thank you to those of you who have joined us. We really appreciate your time. And we look forward to sharing some information with you and gathering some additional feedback. I have a couple of colleagues with me that will be presenting. I'm Jillian Liskey, and I am the Service Coordination Administrator for our Service Coordinations Unit. And I will be presenting information with Sue Spitzer and Colin Large, and they'll introduce themselves when they go through some of the slides and information. We will be recording this session. I believe everybody got the notice when they logged in, but that is something that we're doing. And we are also planning to post this PowerPoint for folks to reference, and it'll be on our public website following the sessions tomorrow. We will have the chat available, so should you have a question or a comment for us, if you want to go ahead and put it in the chat, we would appreciate that. There will be time at the end for questions, and also a couple of questions we have throughout the session just to gain some additional feedback. And so if you have questions on the content we're covering, if you could kind of wait until the end, that would be great. We would really appreciate that. We do have, see if I can figure out the, gonna turn for me? There we go. So we do have a small agenda here. We will be covering our legislative bill 376, some general waiver information, some specific information regarding the family supports waiver. We have some data that we wanted to show you over the survey results that we sent out. And then as I shared, we have some time for questions and comments as well. And so without further ado, I will go ahead and turn it over to Colin Large. I believe you're going to go over the next information at the screen.
Good evening. Thank you for all being here with us today. My name is Colin Large. I am one of the policy administrators here for the state, overseeing our policy and waiver team. So here to talk to you about LB 376. Slide, Jill. LB 376 was passed in April of this last year. And it has, it starts with the premise that the family is vital for the development of each child, and centers families as the core to each child's development. It is intended to preserve family units so that children with disabilities can remain in their homes with their parents, and as with all of our 1915C waivers, avoiding those institutional settings, making sure that parents are able to care for their children. So LB 376 starts with the direction to DHHS and our division, the Division of Developmental Disabilities, to one, develop a family support waiver. This would include developing that waiver so that we can submit it to CMS, the Center for Medicare and Medicaid Services, and also write the rules and regulations that we would need to implement that waiver. And then finally to administer the waiver and submit an annual report to the legislature on how that waiver is going. Additionally, it asks us to consult and provide an evaluation of the state's developmental disability system by December 31st of 2023. To date, the state has contracted with a consultant, Optimus, who will be developing that report to submit to the unicameral. And it will include feedback from families and individuals served on existing waivers and those waiting for a waiver slot. So there will be some opportunities separately from this listening session to engage with Optimus in listening sessions and stakeholder feedback sessions as a part of that consultant evaluation of our DD system. Excellent.
It's very delayed. The slide is moving. I apologize.
No worries. So I'll now turn it over to my colleague, Sue, who will provide some general waiver information.
Well, hi, my name is Sue Spitzer. I'm a policy waiver administrator for DDD. And one of the things I think we're not so good at sometimes is we're always throwing out phrases and terms, and maybe sometimes we don't realize exactly, or we don't realize that others don't always understand exactly what we're talking about. So that's why we wanted to talk just briefly about what the Medicaid waivers are. If you talk to folks in other areas of DHHS, there are all sorts of types of waivers, but DDD specifically deals with, as Colin previously referred to, the 1915C Home and Community-Based Services waivers. So what does that mean? Basically, a 1915C HCBS waiver allows a state to waive certain Medicaid requirements to furnish an array of home and community-based services that promote community living to Medicaid beneficiaries, and then avoid institutionalization in a nursing facility, a hospital, or an ICFIID. And that's important because those are the three types of institutions that the services are waived from. So whenever you have a 1915C waiver, CMS, Centers for Medicare and Medicaid, the federal entity, has what they call an application, and it is an electronic form that we fill out to tell CMS how we're going to administrate and run our waiver. So anytime you have a new waiver, an application form is only approved for 3 years, and then after a waiver is in effect, then you would renew every 5 years. So currently, the state has 4 1915C HCBS waivers, and many of you are familiar with those: the Comprehensive Developmental Disabilities Waiver and the Developmental Disabilities Adult Day Waiver, or as you commonly hear them as the CDD and the DDAD waiver. I won't go through all of this because we do want to save plenty of time for you guys to provide feedback at the end. But those are our DD waivers, and for those waivers, you have to meet the ICFIID level of care, which again is intermediate care facility for individuals with intellectual disabilities. The comprehensive waiver serves all ages, and the DDAD waiver serves age 21 and older. Then we have our 2 waivers where the level of care is nursing facility, and that's the age and disabled waiver and the traumatic brain injury waiver. And for the age and disabled waiver, it serves all ages with a disability, and then folks that are 65 and older. And that's intended to, of course, keep people from having to enter into a nursing facility. And the traumatic brain injury right now serves people 18 through 64. And right now, the only service on that waiver is assisted living, but it's up for renewal, and we're looking to make some changes to add services to that waiver. So the new waiver will be the Family Support Waiver, and it'll be our 5th HCBS 1915C waiver. And for this waiver, children that are ages birth to 21 will be served. Those children will have to be eligible for DD services per the Nebraska state statute, and they'll have to meet ICFIID level of care. The waiver will be intended to reduce unmet needs for children and their families, and per LB 376, Family Support Waiver will serve up to 850 children with developmental disabilities, and it'll provide each child a maximum annual budget of $10,000 a year. So the waiver services, this sometimes gets confusing for folks because waiver services on these waivers supplement the services that are available through the Medicaid state plan. And the state plan is the official document that describes the nature and the scope of the Nebraska Medicaid program. You can go to the Nebraska Medicaid website, and the state plan services can be found there. Examples of state plan services are like your therapies, PTOT, EPSDT, which is the early and periodic screening, diagnostic and treatment, durable medical equipment. Those are all types of state plan services. So again, the waiver services supplement what is already in that state plan that you would get if you were on Medicaid. So Medicaid waiver funds are paid to waiver providers for the services rendered. Waiver funds can't be used for room and board or general home repair or services that would be available from other sources such as voc rehab or the educational system. It can't be used for things like routine child care vacations, and it can't be given directly to the participant. So for waiver providers, all waiver providers have to be enrolled through Medicaid. So they're all Medicaid enrolled HCBS providers. And they're basically two types of providers. We have agency providers and independent providers. The agency providers are generally a community-based company that's certified by DHHS Public Health. And that agency would be responsible for administrative tasks such as hiring and dismissing and training all the agency staff, scheduling staff and bills for services, and would be responsible for ensuring education experience and other requirements for their work. Independent providers are usually, they're not connected to an agency. So usually independent providers are people who are known to a participant. And when you have an independent provider, the participant or the parent in this case, or a guardian, would select and be at least partially responsible for hiring and dismissing and training the provider directly, ensuring the provider can meet the needs, and then creating a schedule of services for the provider. So generally with independent providers, those are people that are chosen by the participant and or parent. And then that independent provider would bill directly to Medicaid for the services provided. So then participant requirements for the waivers. To receive Medicaid HCBS services from any Nebraska waiver, a person has to be a citizen or a legal resident of the United States, has to be a legal resident of the state of Nebraska, has to be eligible for and receiving Nebraska Medicaid, has to have a need for a waiver service, and has to meet the level of care requirement for the waiver that they receive, which that goes back to when we talked about how on the DD waivers, those waivers, you have to meet ICFID, and the AD and TBI, then you meet nursing facility level of care. And a person can be eligible for more than one waiver. They can meet requirements for more than one waiver, but you can only receive services from one waiver at a time. So if you are eligible for more than one waiver, you have a choice of which waiver then you would want to receive services from. And so I'm going to hand it back.
Yes, so now here we just want to provide a little bit of a recap of the family support waiver and just the specifics here quickly. As I talked before, LB 376 was signed into law in April of 2022, and we immediately began internal planning and development of the waiver. The waiver is something that, or the waiver application, I should say, is something that we are currently working on drafts of, are passing around our office and really the entire Department of Health and Human Services, engaging our colleagues from legal services, engaging our colleagues from Medicaid to really begin developing a waiver application that we will be able to turn into CMS, and a set of regulations that we will be able to move over to the Attorney General's office and ultimately the governor's desk. We now here have begun a stakeholder engagement phase. First, we started with that survey, and we're now in a listening session. And it had begun, as I mentioned, beginning that waiver development. We will be looking to move to a public comment period for what will be the final draft of our waiver in April of 2023. That is not a point where we are looking for ideas and suggestions of how we might change things. That is very much a final draft and represents what we intend to send to CMS, where we will take those final comments that we will need to work through with CMS. So now is really the time that we are looking for your engagement so that we can write the best draft of the waiver that we can to submit to CMS. We will be submitting that HCBS waiver application to CMS in July of 2023 and have a goal for final implementation of the waiver of December of 2023. As Sue relayed earlier, the Family Supports Waiver will serve up to 850 children who meet that developmental disabilities requirement as she outlined, and will provide each child with a maximum annual budget of $10,000, and that is a hard cap set by the unicameral. DDD will develop the Family Supports Waiver, including submitting it to CMS and receiving final approval, writing and getting approval of all the rules and regulations necessary to implement the waiver. We will ultimately be responsible for administering the waiver and also submitting that annual report to the Nebraska unicameral. Again, in recapping, the Family Supports Waiver eligibility requirements are that a person must have a developmental disability as defined in Nebraska statute, which includes a diagnosis prior to the age of 22 that is expected to continue indefinitely, and that disability must result in substantial functional limitations in each of the following areas of adaptive function: conceptual, social, and practical. And then finally, meet that intermediate facility level of care for individuals with intellectual disabilities, as Sue mentioned, and that would be a level of care tool that we use with individuals to ensure that they are eligible to receive our waiver. The Family Supports Waiver, as set out by the unicameral in LB 376, does identify certain priorities in funding. If there are more than 850 individuals that need to be served by the waiver, first we would look for children with disabilities and family units in crisis situations in which the child tends to self-injure or injure siblings and other family members. Those would be priority one. Priority two is children with disabilities who are at risk for placement in juvenile detention centers or other institutional settings or out-of-home placements. Again, looking to make sure that we're maintaining that family unit. Our next priority, priority three, would be children with disabilities whose primary caretakers are grandparents because no other family caregivers are available to provide care. Our fourth priority would be families who have more than one child with disabilities living in the family home. And priority five is based on the date of application, first come, first serve as priority five. These are outlined in the bill, and so these are the priority categories that we will be implementing in the waiver. I'll now turn it back over to Jill, who will talk about the stakeholder engagement and survey results that we've received.
Thanks, Colin. Yeah, so we want to acknowledge all the valuable information that we did receive from stakeholders prior to this session. There was some really great information that was shared during testimony from families. We also received information from our advocacy groups that was shared with us. So we really appreciate all of that partnership and information being shared with us. We also wanted to make sure that we didn't miss anybody. And so that was the intent of the survey, was sending that out to make sure that of the information that was shared with us, is this still correct? Did we miss anything? And so that was information that we wanted to gather again to be able to move forward to further develop the Family Supports Waiver. And then of course, the listening sessions today and tomorrow. So these were the identified services and supports that have been shared with us again through that testimony or through again the advocacy groups that had shared the information. I'm not going to read all of these on here. I'll just wait and kind of pause for a minute. There were a lot of services that were shared that were needs for families. The additional services and supports that we found through the survey that hadn't been shared with us, or maybe just additional information, were these services. Therapy for caregivers, service animals, visual and hearing impairment equipment, peer support specialists, support for qualifying independent providers, developmental therapies, legal advocacy, directed personal care assistance, family member transportation coverage, Braille documents, in-home educational services, looks like some 20 hours a week support staff, over-the-counter supplies and medications, and some support residentially. So these were additional services, again, that had been shared through the survey that was sent out. Some of the data we wanted to share with folks. So we had 375 people complete the survey. So these were the top 5 critical services and supports requested. So this isn't, you'll notice if you add up all the numbers, they don't all equal 375, but of all the services that were listed out on the survey, these were the ones that were requested the most. The green box on here would be the total number of response for that service. So this first column here, the family caregiver stipend, 160 people who completed the survey indicated that this was definitely a need. The family caregiver training, 74 people of the 375 had listed that as a critical service. 124 folks had indicated participant directed goods and services was something that would be needed for families. 102 independent living skills, and 136 respondents for respite. On this slide, you'll notice that there are also other numbers next to each of these, and we thought it would be valuable to see of everybody that completed the survey. So there were families that had filled it out with loved ones with disabilities, there were professional folks, there was advocates. Of all the people that filled it out, we wanted to see for families today living with a loved one that has needing some services, what were they indicating were the top critical services? And so that's what you're going to see. The yellow lines are those for children 0 to 14, those critical services selected, and then the line would be those youth 15 to 20 would be the services that were identified as being the most critical. So something we thought would be helpful for us, given that so many families had identified family and caregiver training as a need, we would really be interested in knowing what kind of training would be the most valuable. What are the training or what skills are you looking for, are families looking for to be able to be covered under this waiver? I believe I have given the option, so you're welcome to unmute yourself and share, or you can also indicate it in the chat, whatever you're most comfortable with. But we would love to hear your feedback on what types of training is needed.
Thank you. I'm on a WebEx. I don't know how I can unmute.
Jara, are you, I'm not sure if this is your voice I'm hearing. Can you hear me?
Yes, it is.
Okay, yeah.
I wasn't sure if I was on mute or not, but obviously not.
Nope, you're okay. Is there some ideas that you have for family caregiver training?
You know, I think what I see in the role that I work now and as a former family member, I think a lot of what I see is just basic nurse aid care. What's the best way to move a person, help them transport safely? What kind of equipment would be helpful to them so they're not working so hard? And the same thing with like, if a child has like, maybe there's a need for G button feedings of some type. It's almost like needing to know who the go-to is for Oh, just dietary requirements and needs, that type of thing. Because I can tell you that not all pediatricians know the ins and outs and the formulas, that type of thing.
Okay, thank you very much.
I think that would be helpful.
Okay, great. Thank you for sharing. I appreciate you feeling comfortable enough to unmute and share with us.
Another question that we would have for the room is, we're all here online. Do families feel that these are more likely to be in-person trainings or online trainings? Because that may help us to write a better definition of a service when we look to submit this.
So this is Sarah, and I would say that if it's possible to offer both, that would be great. Recognizing that Nebraska has a lot of areas of our state that are rural. And so platforms like this, Zoom or WebEx, are really, really awesome for families that can't travel and don't have access to agencies or so forth that would provide in-person training. But I would say both would be best.
Okay, thank you, Sarah.
I'd like to learn, I'd like to be able to receive the trainings and education that I need to care for my children myself, because I'm the one that's around my kids all the time.
Mhm.
And a lot of places are short-staffed and can't help, even if they want to. So, and then when I do learn from different places, like how to care for kids with autism and ADHD and all of that, they all tell me something different anyways. So I would like to just, be able to take care of them and then have a little extra support when I can, when places can come and help me, because they're always going to be with me. So that would be awesome.
Great, thank you, Tanya.
Edison from the ARC here, and I would back up. I think it's tremendously important to have both options, both in person and virtual. And then in terms of types of trainings, I think there's a huge need across the spectrum, as y'all know. Our families are overloaded. One state senator, I think, put it well after just having heard a training about the basics of DD services and VR. It's like drinking from a fire hose. So I think the more information and training we can provide, the better. I think the trainings that I think would probably be the most beneficial are some of those, like the parent-to-parent trainings that happen in other states, I think is a huge one. I know that we did a brief little training on just kind of, I think it was a disability leadership training with MMI that covered a spectrum of issues. So needs to cover, special education, needs to cover, kind of that medical side of need, the financial management and tools, because there's so many things like enable accounts or special needs trust that families don't understand. They don't have any sort of support or information for that could be tremendously valuable. And making sure that we're really looking, across the spectrum, not just in terms of, like DD specific, but looking at, what is that whole picture, if that makes sense.
Yeah, great. Thank you for sharing, Edison.
I want to call out here a couple of things that have come through in the chat just to make sure that they're in the recording. Mandy Wilson called out, I've heard a lot of parents state that they need to know de-escalation techniques, also knowing how to be prepared for a future possible waivers, so future planning. Angie Gleason said parents of autistic children with language delays need training on ways to interact with and communicate with their children. One father told me he wants to know how he can be a good dad. So those are two that have come through the chat.
This is Adam, longtime listener, first time caller. I agree with everything you just read on chat and everything that everybody else said. My argument would also be that the state needs to track not only in person and Zoom meetings or, online internet meetings, but record and make it available and advertise it available online and watch how many parents look at it, watch it multiple times, even after the first time it's aired. A lot of us as parents are very busy, and sometimes we can't make these meetings, whether we're at work or we have to deal with our child, right? And I don't say deal with our child in a bad way, but we're parents first, right? And there are times we would love to be here listening to these, and I'd love it if at 9:30 I had a link I could go listen to, and then again tomorrow morning, right? So I would challenge that too.
Great, thank you very much for that. That's great feedback.
I also need help learning how to prepare my home for a growing child, like child-proof, but growing child, like, because sometimes, like just today, she's trying to get into things that I didn't think about before. So like, ongoing training for a child that doesn't know how to not escape. I don't know how to word it properly.
Okay. No, thank you for that feedback. If you think of other things, we have captured quite a lot of ideas and topics on here, and we really appreciate that discussion. You can also share it. I think we have indicated on the survey, I forget what email address it was that we used. We'll try to put it in the chat here, but if you have other feedback after the fact that maybe you forgot to share it during this session, we will also make sure to provide that address, so then that way you can provide that feedback then as well. I did want to share, there was a little bit more data that we had. I thought we could maybe work through that also. So one of the things that we also thought would be really helpful to share, so of the 375 folks who completed the survey, we thought it would be helpful to identify what those top 5 barriers were. Oftentimes we see an alignment between the needed services and the barriers, but sometimes it is different. And so there were 90 folks who identified just unable to access those needed in-home services. And so that was something that had been identified as a barrier for families living with somebody in their home with a disability. Insufficient financial resources, and even Edison, I think you spoke to that a second ago too, maybe just not even knowing what those options are, in addition to not having enough resources in your home to be able to have childcare or meet the needs of your child. 75 respondents had indicated unable to work because you need to care for your disabled child. 89 folks had indicated unable to spend time with other siblings just due to the higher needs potentially of your kiddo with a disability. And 105 people had indicated that they were unable to afford extracurricular activities for the child who had a disability. So we thought this would be helpful to also know what those 5 barriers are, so that we could work on our end to help identify services to relieve some of that additional stress.
All 5 of those barriers scream family member guardians as paid independent providers. Family caregiver stipends.
Say that last piece again, Adam. For
family caregiver stipends. All 5 of those scream like, hey, we want to be able to take care of our own family member, but we can't because we have to go to work.
Right.
Because we have to pay for food and clothes and a house and all that. All 5 of those things you just read scream family member guardians as paid independent providers.
Okay.
Screams it.
Okay, thank you. So, and I'd be kind of.
Can I jump in? The other thing that I would ask is that one of the top services was, I can't remember what you said, recreational services for their child that has a disability. Camps are a huge need in our state. They're expensive, but they are so awesome when families can send their child to it, but it has to be specialized for this population oftentimes. So
yes, we did get a lot of folks who did check that on the survey for that kind of caregiver or the extra services and goods to be able to help pay for YMCA memberships, gym memberships, camp fees, those sort of things. So yes, thank you very much, Sarah.
The other thing that I would say is that it would be awesome if, when you think about therapies, we think about medical therapies like PT, OT, and so forth, that kids get really tired of going to the doctor. And so there are other therapies that kids like to go to and families don't have to fight them to go to, such as like hippotherapy or, music or art therapy. Some of the, I guess I just asked if those would be things that we look at. Kids are a lot different than, yeah.
Yeah, thank you. That was identified. We had gotten that information, Sarah, also through testimony, and the advocacy groups had shared that with us, that those were much needed therapies. So thank you for sharing that. This came up a second ago when we were having the conversation regarding the trainings, but we did wonder if folks in the Zoom had any thoughts on whether or not there was a difference between urban and rural communities. We of course have some assumptions of what we think, but we're wondering for where you live, if you are noticing a difference between services in your area, and maybe could share those with us.
I have noticed that having a child with a disability, I don't think that we can move to a rural area in Nebraska because there are not providers, there are not services, there is no respite care. I mean, I just imagine it's very difficult. I live in Omaha, so I live in a very metropolitan area, but I just imagine people in the rural areas of the state really struggle. And my husband and I had talked about moving previously to a rural community before we had children, but now we realize that's not a possibility anymore.
An option. Okay, so much limited options in the rural areas.
I would also add that even in Omaha, families can't access specialized childcare. So as an example, we think of CRCC, but I was just recently working with a family who has been on a waiting list for after school and weekend care for 2 years. And so if Omaha can't do it, how does the state help families get access to specialized childcare? Or how do we help there's just a huge need there.
I don't know about it happening here in Lincoln either. So is it happening anywhere in Nebraska?
I'm more familiar with the Lincoln and Omaha areas myself for the specialized childcare. And now I got to remind myself, I am pretty sure that this is a service that we offer to be supported by an independent provider as well. And so I'm thinking in our rural communities, that's oftentimes what families are doing, is finding a neighbor or a daycare close by who has the ability to help support their loved one, and then they're working to enroll them as an independent provider to provide that service.
Currently, I think it's just independent providers. I do know there is one agency out in Hastings that's looking at applying. I think as I've talked with a couple of agencies that are interested, one thing I don't think we've talked about is the application. For most DD service providers, that application is pretty significant. And I think with this waiver, we're going to see a lot more folks who come from childcare agencies or who, may have a different background. And so I think one important piece is finding a way to cut down the paperwork and have a more streamlined application, considering you're not going to have all the same needs that like a residential provider might have. And I'm hoping with this waiver, we're going to see some new types of providers. And I think we may see some agencies who haven't been DD service providers who want to step into that role, but they don't need everything from the residential. They just need, the nice little top line.
I agree with Edison. I think historically we've looked at families who have,
Oh, goodness. I think we might have lost her.
Well, she's I wanted to add in, I think some of our highest needs that I consistently hear of in rural communities, ABA is like always number one. PT, OT, speech, and then especially when you have dual diagnosis, and so you've got somebody with behavioral health issues and IDD, and the lack of expertise there is really significant. We've also heard the same for things like hearing aids and such, and making sure just that those are available across the spectrum. Yeah.
Okay. Thank you.
This is Kristen with the Nebraska Council on Developmental Disabilities, and also a parent, but my child is an adult now, but I remember living this. And one of the issues in a rural community as well, and it could be in the urban, is the issue of transportation. So when services are set up for perhaps a respite provider or somebody to provide that community outing experience, they need to be compensated fairly for their transportation, including travel time to get there, because during, in those rural communities, if you're only getting paid on the clock when you arrive, that can be a huge barrier.
Thank you, Kristen.
One thing that I don't know if this fits in the conversation right now, but I would like the state to consider whether or not the Early Development Network could do services coordination for children birth to 3, like they do for the aged and disabled, Medicaid waiver for continuity of care.
Okay. Thank you, Sarah.
I would like to see more education in the school boards. So I'm in a major, call it Omaha metropolitan area school board. We have a new principal who's been an educator for 15 years, and we do an IEP, and she's learning from us.
Kind of continues to compound the struggles you're already having.
Correct.
I'm gonna, I think, move on to the next. We just have a couple more
Sarah
slides.
just wrote
Oh, I'm
her
sorry.
hand up, and we maybe can take hers before we move.
Yeah, absolutely. I didn't see it. Thank you.
Yeah.
Jared, did you want to share with us? Okay, well, we'll go ahead and move forward, and then there'll be some time at the end. I think that maybe we can continue this conversation if necessary. I think, Colin, if you want to go through the next steps, then we can just really open it up for discussion and dialogue.
Yeah, so we just want to take you through the next steps so that you all are understanding kind of where we go from here. So already we've engaged with technical assistance from CMS. This is a formal process that we always engage with new waivers and renewals, just to get some additional feedback from them and the consultants that they work with. We'll continue developing the waiver and the regulations that we need in order to ultimately submit to CMS. We will go to public comment, as I mentioned, in April of 2023 is when we tentatively have that scheduled. That we would go to public comment. That's the final draft. That's what we intend to submit to CMS. And then ultimately submit that application after public comment to CMS for their approval. Want to talk to you just a little bit more about what technical assistance from CMS means. We have already requested that assistance, and it is, we're currently paired with a consultant that is the consultant brings together individuals who have worked with other states and in other states on the development of these same kind of family supports waivers. And so they are able to bring us real world expertise and real world experience in how exactly to write a waiver, to implement a waiver, and can help us and coach us through that process, and are doing so with CMS. And so it's really important, and we find it especially valuable because a lot of the feedback we can get through the technical assistance process is making sure that we're answering the kinds of questions that they know CMS will ask, so that we can answer those questions in advance and not be surprised after we've submitted it for approval to CMS that suddenly there's a new issue we hadn't thought through yet. So we have provided that consultant with a copy of the stakeholder engagement feedback that we've already received from stakeholders, to have them incorporate that into their research and their recommendations. And we'll be providing them with copy of the survey, as well as all of our notes from these meetings, to make sure that they understand what folks are saying and concerns that folks have within the state, to make sure that their recommendations and their research is responsive to those kinds of questions. The technical assistance will provide insights into what other states are doing with family supports waivers, including services, regulations, quality indicators, and really work between us and CMS to make sure that the waiver written meets CMS expectations and best practices, to ensure that there are as few questions after submission and as few changes after submission to CMS as possible. As I mentioned, after the submitting of the waiver to CMS is just the first step with CMS. Ultimately, after we submit to CMS, they will review the waiver, and we will engage with discussions directly with CMS and our partners there, and answer their questions and make any required updates and changes based on their feedback. Once we've made those updates, made those changes, answered the questions that they have, the ultimate goal, as you all know, is for CMS to approve the waiver as amended, and then ultimately for us to implement that waiver. So the next steps those are our next steps here at DHHS. The next steps for you as stakeholders to be aware of, because we want to make sure that while we're leaving with action items, that you also know kind of what the action items are going forward. So for next stakeholder steps, we will be making updates regarding the status and the progress of LB 376 to the DD Advisory Council. That's who is formally overseeing the development of the waiver. And so we will be providing updates to them at each of their meetings. And those are public meetings. So feel free to attend, feel free to listen in, feel free to look up that group online and ask them questions, or ask them to relay questions from you. We'll also be posting all of those updates as well as others to our website, and are working to develop a website specifically for the waiver, so that you have access to information and updates regarding the development of this waiver. We will have other stakeholder information sessions later on in the waiver development phase. There are a lot of things that are new to us. There are a lot of things that we anticipate will be new to families and participants and providers. And so we don't view this meeting as we're giving people two opportunities to talk with us, and then we'll see you again at the end. We want to make sure that this is a continuous process where we're continuing to listen and engage with you, and also to inform families of where we're at with some of those discussions, the things that we learn, so that we can all be informed together of what it's going to mean when we implement this waiver. Already in this conversation, working with our partners in Medicaid to talk about what services will be available ultimately through Medicaid and through EPSDT, and what services will be available through the waiver, and making sure that families know who they will be working with and talking to receive all the services that the waiver will ultimately provide, either through the waiver itself or through the Medicaid eligibility. We will, of course, have the final comment, or not the final comment, the public comment, taking comments and questions back on our final draft that we'll submit to CMS in April. And then we'll have, after that submission to CMS, have family and caregiver implementation trainings, teaching folks what they need to know as we look towards implementation of the waiver. What do service definitions mean? What do folks need to be able to do to apply, to deliver services on, to be participants in the waiver? What does that kind of implementation look like for families and for caregivers? So those are y'all's next steps as we move towards implementation. We're now here at the closing of our formal presentation, but want to open this up again for closing questions that you may have or other comments. And it looks like we have about 10 minutes left in the hour to hear what kind of ideas we may not have touched on, what kind of comments may still be out there. I do see one question from Tanya in the chat. Will there be anything to help for families when school is out? Our kids really need consistency. That will be definitely something that we'll be looking at as we try and define what services are out there and how we define those services to make sure that we are, I think that idea of consistency for children is really important for all children, but especially for children that may be living with a disability, important to have that consistency in their lives. And so that will be something that we will be keeping in mind as we're developing and drafting services.
Something that I would like to be considered is also the families that have children with a progressive disability that somehow, like, they need to be included on diagnosis versus waiting until they're disabled enough to qualify. That's definitely something that needs to be considered. Because care needs are there, like with muscular dystrophy, that's something that's there on diagnosis. It doesn't go away. So that's something I would like to be considered.
Thank you.
I think our biggest concern is making sure that this waiver moves forward and is approved speedily. But with that, a little more complex piece, I think, is building some of the variety of providers and helping to go and start up new services that providers may not be experienced with, and hoping that within those rate structures that's thought through as these providers try and stand up things like, specialized childcare, great service, highly needed, but very few providers do it. And so getting that up and rolling is going to take some extra resources.
I will say in the organization of our kind of internal team that is looking to develop and write and move through towards submission of the waiver, we have organized two kind of stakeholder groups. Jill, in her role as the service coordination administrator, is leading our stakeholder groups that is tasked with reaching out to participants, families, caregivers, folks who would be caring for those individuals receiving services. We have an entirely other stakeholder engagement kind of subcommittee that is tasked with reaching out to providers and talking with providers, because we do recognize that while we can write the waiver and have services available and their families can have needs for services, without providers, no services will happen. And so that is a separate thing that we are working on and working to develop, is really robust communication and engagement with potential providers on this waiver.
Okay. Can you circle me in on that, Colin?
Sure
Okay.
thing, listen.
This is Jara. I'm not sure if you can hear me or not, but I also wanted to make sure that you guys were being cognizant of language issues, because there are families that are non-English speaking. you know, as things progress with this waiver, I think it would be good to make sure that the information is bilingual and that there are maybe even bilingual specialists available in different areas to help families maneuver through some of this stuff.
That is something that we are working on developing now, developing a section of our website for those public materials that are available in other languages. And it is something we will be working to translate documents that outline this waiver into, at minimum, our primary 4 other languages. But then always any requests that we receive from the field for translation either of public documents or of individual documents. We look at around a 2 to 3 week turnaround, but we do want to be responsive to those requests for publications and materials in other languages.
Can I challenge you? What are the other 4 languages?
Arabic, Vietnamese, Karen, and Spanish.
Okay, perfect.
And as far as those languages, I think it's fine to have the written information as well. However, there are a lot of Spanish families out there that are unable to read. So I still think it may be important to consider having an actual bilingual specialist available for the families that do speak those other languages rather than just the written language. It's something to consider anyway.
Yeah, we appreciate that feedback, the idea of language versus literacy, and those are not necessarily synonymous.
And the other thing I wanted to mention, I think the state's doing a great job with working with caregivers within the community, child caregivers. However, I think it would be it could work where you just kind of work that extra, the special needs piece into that. Because there's a lot of young children out there that have disabilities who are very easy to take care of, honestly, except maybe they have a G button. And, you know, that's scary to a lot of folks. And if parents aren't confident enough to teach and to help build that relationship with that caregiver, I think we're losing out on a lot of opportunities for caregivers. And I know in our situation years ago, I think the childcare setting, it's only really defined till age 12. Is that correct? Which once again makes it difficult for families that have kids with special needs in that 12 to 18 year frame.
We're trying to remind ourselves of the age that the childcare goes through, but I think it is through 18. It's just that the parental portion is through 12 or 13, and then there's no parental portion past that. But
however, childcare facilities, a lot of times their license is only up to age 12.
Yeah. And
gotcha.
And the Title 20 reimbursements only work up until that age, and that's only like $5 an hour. I think one of the things that this waiver could help to solve is going and making sure that those rates are actually fitting, and for those older children. And there's a huge gap there. You know, somebody with complex needs, you can't serve them for $5 an hour. So making sure that you've got rates that actually fit, that are designed around a kid with medically complex needs, I think is super important.
And I think right now, even at $12 an hour, people are having a hard time finding anybody. And that's more than the $7 that most of our providers were getting years ago.
McDonald's is hiring at 21 an hour right now.
My children
Mhm.
require one-on-one paras at school. So if I take them to a childcare provider and they can't have one-on-one care, then I don't see how that's fair. Like at school, they require a one-on-one para. But a childcare provider has to have 20 kids.
Well, and I think we also have to remember not all schools are created equal when it comes to allowing paras.
I do want to read in some comments that we've had in the chat. One comment, like Adam said, is there currently a place to find past Zoom trainings, conversations, etc.? I noticed this one's being recorded. This one will be posted. Our website does have something, some trainings, recordings posted, some resources posted. But I heard that feedback and that comment as kind of a desire for more of a clearinghouse, where there would be a lot of different trainings, not just perhaps state informational sessions or state trainings that would be posted. And I think that's valuable for us to think about. One comment was reflecting that there aren't services now and how we can quickly build those. And that is something that we are thinking about, and one of the reasons that we have prioritized provider engagement as well. Another comment that was that FBAs are difficult to get approved for under 21. It would be amazing if that was maybe a part of the startup of this kind of waiver. Challenges of procuring services, I believe, is what they're also asking about with that $10,000 cap. And then another comment to the childcare, that many childcare groups won't take a child after age 7. So some comments there that we can now have reflected in the transcript.
The other thing that I found recently is a lot of families that do have Medicaid because of the waiver are not familiar with what the plan offers, just the basic things that are shared on the Heritage Healthcare comparison sheet, like YMCA memberships or free shipments of free vegetables and fruit every 3 months. Coverage of over-the-counter medications. The things that are on that Heritage Healthcare comparison sheet, I think there's a lot of families in Nebraska, maybe not even just necessarily families with special needs, but they are not understanding that they need to be consumers of their Medicaid.
And I think
Yeah, I think that's the reasons that, you know, the information sessions going forward will be so important. Folks moving into or onto this waiver, there will be a lot of new opportunities, new doors and windows opening, both within the waiver as well as within Medicaid, and making sure that folks are savvy consumers for those new opportunities that are presented. What's already there? What are new opportunities through Medicaid? What are new opportunities through the waiver you know, there was a discussion that we had this morning in technical assistance of that blending and braiding. How do all of the pieces really fit together to provide the services? Understanding that Medicaid is not a complete answer, nor is the waiver, nor is you know, perhaps the K-12 system. All of these pieces need to come together and work together in order to support families and individuals.
And Colin, if I could
But
just add something that's really important too to note is with this waiver would come service coordination to be able to help assist. And so that is one of the roles of a service coordinator, is to helping that family understand what services might be available through your state Medicaid plan, what services are available through that Family Support Waiver, other local or community resources that they're aware of just from working with other families in that community. We know it's a really confusing system and there's a lot of things to know. And we're not experts by any means, but certainly one of our roles is to help families navigate the system. And so that is something that would be not a waiver service, but it would be a service that service coordination would be able to help provide.
And it looks like there's a comment here. A lot of time Medicaid will push that responsibility to waiver, and that there's kind of an alternating between waiver and Medicaid MLTC. And so that'll be something that we'll take that comment back and work to develop we'll have some internal conversations with Medicaid that this is perhaps a training need for themselves, and see how they want to better work through those issues. Just that it's a concern, and also what kind of trainings they may be able to put forward either themselves or through the MCOs, so that folks can better understand kind of where that line is.
So as a parent, my argument would be this: yes, 100% agree with what you just said. There needs to be better training internally. There needs to be a one-stop shop for parents and families to go, these are your benefits, not 19,000 different web pages to go through or fine print somewhere. Here's what you qualify for, right? Very plain, very simple. I would argue most people that I know that are on a waiver, you can sit there and go, they need the help, right? You can look at them and go, well, you qualify for this. Well, how so? You're on Medicaid. What do you mean I qualify for this? They don't even know it, right? So it's not just educating internally, but if you're going to provide the benefit, provide the benefit. I get it. Tax dollars are involved and budgets are involved and blah, 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 blah. But if we're going to provide the benefit, provide the benefit.
I appreciate your comment,
Thank
because
you.
yes, there's a lot of stuff out there that people are not understanding, and even professionals. In the office that I work at, I can't tell you how many parents cannot even tell me what waiver they are on. They don't know the difference between an AD or a DD. They just know that they have Medicaid and that they have a services coordinator, but they don't always know the stuff that goes along with it, including, I could go on, but a lot of families have been paying for diapers and underpads on their own because their child's been incontinent, and because of their health issue. And there's so many families that had no idea that Medicaid would cover that with a doctor's script through a DME over the age of 3.
I see another comment here. I was at a conference and chatted with someone who was in a state that allowed waiver participants to select the organization who did service coordination. Is this a possibility? That would be a change for the state. One of the reasons that the state on the DD side does service coordination through our in-house state service coordination is because that's set up in statute that we are to provide that. But that is something that we can take and can think about to provide more choice for individuals in who and how that service coordination is provided.
I know that many places are not taking some of the like either United Healthcare or whatever the other ones are. I forgot. Because some of them don't pay the providers, and I don't understand how that's legal or how that happens, because if I don't pay somebody, I'm going to be in trouble. So, but that comes back on us, and then we're not able to see the providers that are out there. And as Medicaid participants, and so I guess I just I don't know where I was going. My head started hurting. Like I got lost in my thought. So I don't know how to deal with all of that, because then I'm like, I want to choose between all these different plans so that I know, I want to be able to get the best, plan that is available out of the Medicaid options. And yeah, I guess I just don't understand how this is possible. And I'll just leave that to you all.
Well, I know that we've gone a little bit over, about 10 minutes over, and we really appreciate everybody's time. We know you're incredibly busy. Many of you are doing triple duty right now. And so we appreciate the feedback. Thank you for the comments in the chat as well. As we shared earlier today, we will take this feedback and we'll use this to help us draft and develop those service definitions, and then create the waiver and the regulations that'll be needed in order to implement the Family Supports Waiver. So if you know of anybody who would like to join us tomorrow at our session, I believe it's at 9:30 in the morning Central Time, and we will be going over the same presentation that we went over just now and just soliciting some of the same feedback. As Colin had shared earlier, you could watch on our public website. We'll have a spot on there with specific updates as to where we are at DHHS and our division with the Family Supports Waiver. So thanks again to everybody who joined us today. We really appreciate your time, and I'm sure we'll all be in touch again sometime soon. Thank you.